As snow piles up, people start to show up at doctor's offices or the ER with injuries that are often preventable. I'm here with Dr. David Morris, a surgeon at Intermountain Medical Center. So you were talking about in December, you start seeing a spike in injuries. Talk about that.
Right. Falls is the #1 mechanism of injuries that we see. And in December and January, the colder months, we see an increase to about 40% of our admissions are due to falls.
So I imagine you'll see some people who may come to the emergency room because of skiing accidents, but you're talking about people who are just out and about, walking on the sidewalk, on the street.
Yeah, the everyday boring kind of walking to my car kind of thing. Yeah.
What types of injuries are you seeing?
We see a lot of head injuries, especially in the elderly patients or in those that are on blood thinners are particularly at risk. But even it affects all kinds, all ages and all types of
So not just people walking, but what about people in their cars slipping and sliding in dicey conditions?
Sure, it seems like every year in the first snowstorm there's sort of a spike at the beginning, people learning how to drive again. It's just everybody's in a rush in the holiday season, and it just takes more time.
And then we're seeing kids sledding, and then you think it's so fun, and then in a quick instant things can change.
Right, and there are certain easy things that you can do. I mean, the simple matter of wearing a helmet can make the difference between life and death, really, in terms of the injury severity. So,
even when you're just sledding, even just going down a small hill?
Right, sledding and tubing in particular, because you can't really control the direction. If you end up head first or you hit a tree, it's just really hard to control. So we'd always recommend that people be safe about it, be smart about it, find a place that's safe to sled, and make sure you don't overload the tube or the sled, and you have a bailout option.
That's right. And so you're saying a 40% spike in these next couple of months?
We see in December and January about 40% of our admissions to our hospital for injury will be for ground level fall, so presumably slip and fall on ice.
Would you say your emergency room is busier in the winter than in the summer, or about the same?
It's about the same, but the types of injuries change.
Okay. So a big tip, a big takeaway is to protect your head.
Protect your head.
Okay.
Yep, can't live without your head.
And then what about just the common, just walking around? I mean, you're not going to wear a helmet when you're...
No, I think if you know that you have to travel on some ice, the smartest thing to do is to try to not carry things in your arms so you can help balance. And if you know that you're going to be walking across particularly icy ground, there are devices you can buy to slip over your shoes that'll help, or maybe even carry a stick or a pole or something like that to help with balance.
Oh, that's really interesting. Any other tips and advice?
I think just remember that you may be the smartest, safest person out there, but there are a lot of other people who are maybe not as careful as you are, and that you've got to be defensive about what you do.
All right. Thank you so much. Great
Thanks.
Tips for this winter. And for more information, you can always go to intermountainmedicalcenter.com. We have a link on our website, goodforutah.com. Glenn, back to you.